Good morning, friends. As a nodal officer of Biomedical Waste Management, ESI Hospital, Basaidarapur, I want to say something that regarding the guidelines of handling, treatment, and disposal of waste generated during the treatment, diagnosis, and quarantine of COVID-19 patients or suspected patients. So, what is quarantine? A strict isolation imposed to prevent the spread of the disease. The separation of a person or group of people reasonably believed to have been exposed to a communicable disease but not yet symptomatic from others who have not been so exposed, that is to prevent the possible spread of communicable disease. It may be voluntary quarantine. What is voluntary quarantine? When someone is not ordered to go for quarantine but chooses himself or herself to do so just for caution, or often it is called self quarantine, to obstruct and inhibit the spread of the disease. Now come for isolation. Why I am telling so? Because the biomedical waste generated in case of the quarantine people, isolation people, and for treatment of the COVID positive patients. So now come for the isolation. Separation of someone or person or group of people known or reasonably believed to be infected with a communicable disease and potentially infectious from those who are not infected, to prevent the spread of communicable disease, may be voluntarily or compelled by the public health for go for isolation. So, according to the Biomedical Waste Management 2016 rules, we are first discussing about the admitted patients for the isolation or COVID-19 positive patients. The segregation of biomedical waste, has been classification into four groups. Number one, red. Number two, yellow. Number three, blue box. Number four is a sharp container. For the red container, red beans, having the bags with a double layered bag should be implemented for using two bags for COVID-19 positive patients. What are the items that should be included within the red category? These are the gloves, serum vials, plastic syringes, Ryle's tube, IV bottles, catheters. These are all included in the red category. And yellow category, having the beans and the bags which will be labeled by the COVID positive or COVID-19 tag, having the used mask, gown, cap, cotton swab, and other tissue material which are coming for infection, and the discarded medicines, discarded petri dishes for examination. Now come for the blue box. Blue box, you will that the items which be included are the vials, ampoules made of the glass, कांच के बना हुआ चीज, and the metallic implants, glass slides for the pathological tests. And last is the sharp container, which are included with the needle, scalpel, blades, sharp instruments. And for the general waste, which are not having contamination with the biomedical waste, are come into the general waste category. So, in case of admitted patient or isolated patients in wards, the bag should be double layered bags, and tag should be there COVID-19 cases. Collection bin labeled with the COVID-19 label, and the trolley also. Container and the bin should be cleaned with 1% sodium hypochlorite for sanitization. Now come for the quarantine. It may be home quarantine, it may be quarantine in the camps or centers. In case of the home quarantine, household waste are come under the general waste. It don't come under the biomedical waste. But in home quarantine, if the patient becomes symptomatic, and the mask that should become in the yellow category. In case of the quarantine camps or centers, yellow colored bags, the biomedical waste mask, that should be in the separated dustbin of the yellow. Now come in the two category of the occupier and operator. We are the occupier, the hospital people, and operator are the biomedical waste, which would be ultimate disposal करते हैं जो वो है operator. So for AB home quarantine camps, the yellow bag should be collected by the operator people, which are सेंट्रल पॉल्यूशन बोर्ड जिन लोगों को हायर किया है या नॉमिनेट किया है. So hand over the yellow bags and contains with the biomedical waste generated, and the occupier handed over the yellow bags to the operator. The operator, that is SMS Biotech company, they deposit the BMW yellow bags designated to the disposal center. Now, the COVID-19 positive cases should not be treated in the quarantine camp, quarantine home or home care. BMW generated in the quarantine camp, these are the quarantine home are the domestic hazardous waste, and the separate record of the collection, treatment and disposal of COVID-19 waste should be recorded by the hospital authority, that is the occupier people. And same thing should be happen to the operator people, those who are collecting the biomedical waste for COVID-19, tagged with the yellow dustbin, red dustbin, or the container having the sharp container should have to be recorded properly. The workers of the biomedical waste should be provided with a PPE having 3-layered mask, splash-proof apron, gown, nitrile gloves, gumboots, and safety goggles. There should be designated staff collecting the biomedical waste for the quarantine and home care quarantine by the operator and the governing body of Delhi government and Central Pollution Board. The carts, trolleys and vehicles all should be sanitized properly with 1% hypochlorite. Thank you. Thanks a lot.